Hi, this is the Modern Dental Assisting, Chapter 52, Part 1. We're going over removable prosthodontics today, but we're going to go over the partial denture. So, removable prosthodontics replaces missing teeth. And the removable part of it means that the replacement teeth can be taken out freely. So they'll be taken out of the mouth and put back into the mouth. So they are not fixed, they are not cemented in at all. So the removable partial denture replaces one or more teeth in the same arch. So it has to be on the same arch that it is missing. The removable full denture replaces all of the teeth in one arch. Now, the removable full denture, we'll be going over that lecture tomorrow, but the removable partial denture is what we are going over today. So extraoral factors that they look at is physical health. Some factors in physical health could be like diabetes or overall poor over poor overall health. Mental health, if they are in poor mental health state, they may not be able to tolerate the taking out and putting in of the appliance. So they might be irritated and overly concerned about the denture or partial in their mouth. And if they have a severe mental disability or mental decline, they might not be able to keep the appliance in place or maintain adequate oral hygiene. We have to make sure that the patient is motivated and actually wants the appliance. Some patients aren't concerned with replacing their missing teeth, and if they're not going to wear the appliance and they don't want the appliance, we need to know that as well. We need to think about their age. Some patients may be very young, and this may not be the best and most suitable option for them, and we may need to go other routes. Dietary habits, what kind of things are they eating? Are they grinding? Are they, what kind of diets do they have? Social and economic factors and their occupation. So some people may have an occupation where they're in front of a lot of other people and may be very self-conscious about how they look and what their smile is like, and they may not like the looks of the partial denture, like the clasps and things like that. So the aesthetics of it may be a problem for them. So they may want to go other routes like implants, where they do not come out of the mouth and you don't have the hardware that you see. So all of those things are extra oral factors, things outside of the mouth that we have to think about prior to doing these procedures. Intraoral factors and things inside of the mouth that we need to think about prior to doing these procedures are musculature. Facial muscles contribute to retention and functional control of the prosthetic. So a strong muscle attachment and good muscle tone is very important for your patient. But on the contrary, if they have very large or very active tongue, it might cause difficulty in retention and wearing the prosthetic. So a patient with a nervous or facial habit might have a very difficult time retaining or adjusting to a prosthetic. When we go down to salivary flow, the presence of something foreign like a prosthetic in the oral cavity can stimulate excessive saliva flow. So at first, they'll have a lot of extra saliva. So they'll have to get used to that prosthetic being in there. And until they do, they're going to have like a lot of extra spit in their mouth. So if they're and once they become accustomed to it being there, that saliva will diminish, because what that happens is the mouth thinks that it is food. So the mouth creates saliva, or the body creates saliva to break down the food in the digestion process. But if your patient has experienced a stroke or another type of neurologic disorder, or if there's paralysis, the prosthetic might make saliva control more difficult. So in contrast to that, though, if the patient has a lack of saliva, they might find it very difficult to wear that prosthetic and very uncomfortable, because their mouth could be very dry, and making that retaining that with the little saliva could be very difficult. with a residual alveolar ridge. Successful wearing of removable prosthetic depends on the support provided by the alveolar ridge, which is the bone that holds the natural teeth in the mouth. If it's at normal height and it's evenly contoured, then it should provide good support and allow for even distribution of the stress of mastication or chewing. Now, if the ridge is resorbed anywhere, then that can result in a sore spot for the patient. Resorption occurs when the alveolar ridge has resorbed because of the loss of teeth, causing an uneven distribution of pressure points on the prosthetic, which keeps it from fitting properly. So in some cases, it's necessary for the surgeon to perform an alveoplasty, which is when they recontour the alveolar ridge to surgically minimize those problems and smooth it out. So they kind of clip that bone in between where the crests are of the bone to make it more even. And then they take they use a bone file and then they smooth down those points. So doing that alveoplasty will make the prosthetic fit better. With the oral mucosa that covers the ridge, it's altered by the patient's physical conditions at times, and the prosthetic can cause friction and irritation, and it can become difficult for the patient to wear. So if they have a poorly fitting prosthetic, it can cause irritation and sore spots known as pressure points. So if we see them promptly, we can relieve those pressure points and sore spots for the patient. There's also tori. So if the patient has tori, it's a benign overgrowth of bone in a specific area. The mandibular or maxillary tori, when present, can affect the ability to wear the prosthetic. The other thing is oral habits, such as clenching or grinding, can cause extreme stress on the ridges and the remaining teeth. Those teeth have to be considered when selecting a removable prosthesis. Mouth breathing may affect the patient's ability to hold the appliance in place. So all of these things have to be considered prior to having the prosthetic designed. Indications for a removable partial denture, or reasons that we would want to do a partial denture, would be to replace several teeth in the same quadrant or same arch, to temporarily replace missing teeth for a child, which is not something that we do often, but it can be done. And in my experience, I have seen that mostly done for pageant children, ones that are participating in pageants. Because children grow very rapidly, and if you are making a partial denture, it is expensive. And if you are going to be putting it in a child, they're growing, so they outgrow it very rapidly. So you have to keep fabricating that. So that's why they typically don't do it for children. Replacement of teeth for a patient who does not want a fixed bridge or implants. That is something that is very common. Fixed bridges and implants, not only are they longer procedures and more in-depth procedures, but they are also more expensive procedures. If this is a patient who finds it easier to maintain for good oral hygiene, so maybe it's easier for the patient to clean the teeth, removing the partial denture. And it can serve as a splint to support periodontically involved teeth. So if they have some teeth that have some periodontal problems and they're already a little wiggly, they could use this as a splint to hold them in place and to help support them. Contraindications to the use of removable partial denture would be lack of suitable teeth in the arch to support, stabilize, and retain the removable prosthesis. So if the teeth that were remaining in the arch were not good support teeth, they did not have good bone around them, they were decayed, things like that, we would not want to use them to support this prosthetic because those teeth are going to be part of the denture soon if they are decayed or have a lot of bone loss. Rampant caries, severio-periodontal conditions are part of that rampant caries and severio-periodontal bone loss. If there's a lack of patient acceptance for aesthetic reasons, like I said before, patients that may be involved in public speaking may have concerns about clasps and things like that, like the silver hardware on a partial denture. They may want it to look very natural so that no one knows that they have replacement teeth in there. Or if they have chronic poor oral hygiene, because if they have chronic poor oral hygiene, the other remaining teeth are eventually going to decay and have to be taken out as well. So with the components of a partial denture, the first thing is the framework. The framework is the basis of the partial. So it's a cast metal skeleton that provides support for the remaining parts of the prosthetic. Then the connectors are what join the different parts of the partial together. Retainers support and provide stability to the partial denture by providing a circling and abutment tooth. So the retainer, or what goes circles around the abutment tooth, or the natural tooth that is left in the mouth. So remember, an abutment is a natural tooth. A rest is a small metal projection that is designed to control in the seating of the prosthetic. So the rest goes onto the natural tooth, and it helps to seat it, or so that it sits and like, I don't want to say adheres, but like stays in place, almost like a puzzle. And the artificial teeth are constructed from either acrylic or porcelain. Now they're typically constructed from acrylic these days because the acrylic look more natural. The downside to the acrylic is they wear down faster and they do stain faster, but they look a lot nicer and they sound nicer. The porcelain look nice. I mean, the porcelain, don't get me wrong, the porcelain look really nice as well, but they make that really clacking noise if they touch, like if you have porcelain on the top and porcelain on the bottom and they touch each other, they make that clacking noise. So then people know that you have the fake teeth, and they can chip really easily too because it's like porcelain on porcelain, so that it can chip. So there is a sequence that you have to follow when you are doing an appointment for a partial denture. The first appointment is a records appointment. So in that first appointment, they're going to do an updated health and dental history, a cleaning by the dental hygienist, preliminary impressions and casts completed in stone for the fabrication of the custom trays, either within the office or sent to the dental laboratory. They will do radiographs that are prescribed by the dentist, and then intraoral and extraoral photographs that are needed for case presentation. In the next appointment, they're going to prepare the teeth. So they will select the shade and the shape of the teeth, or the mold of the teeth. So what are they going to look like once they set them onto that framework? And then they will prepare the teeth that are the abutment teeth that are still in the mouth. And that might involve slight modification of the tooth structure, modification of amalgam restorations if they are still present, and placement of cast metal restoration in a recessed area to receive the precision attachment, which is that rest. And then taking final impressions, taking the bite and occlusal registration so that we know that the bite relationship and the occlusal relationship has lined up correctly, and preparing the laboratory prescription so that the lab tech knows exactly how to design the prosthetic. At the third appointment, it's a try-in appointment. So that's when the dentist evaluates the fit, comfort, and function of the appliance. The shade, the mold, and the arrangement of the teeth are reviewed to ensure that the appearance is acceptable to the patient. If necessary, the dentist may alter the alignment of the teeth. The teeth at this point are set in wax, so it's easy to adjust the alignment and the height of the teeth. Once the appliance is acceptable, another bite registration may be required to reflect any changes that have been made. At that time, it will be returned to the laboratory for the final prosthetic to be designed. At appointment 4 is a 20 to 30-minute appointment that is usually adequate for delivery of the partial denture. On the day before the appointment, you need to verify the case has been returned from the laboratory. At appointment 5 is the post-delivery check, and that's when it's about a 10 to 20-minute appointment, and the patient returns a few days after the delivery of the partial denture, and you check for any sore spots, make sure that it's fitting correctly, make sure there's no pressure areas, make any minor adjustments that need to be made, and then make sure the dentist and the patient are satisfied with the prosthesis and it's functioning correctly. Then the patient's given a recall appointment for several months later, as long as everything is fitting and looking good. You will go over the home care instructions for a partial denture with your patient. So it's very important that you go over these home care instructions with your patient before they go home with the partial denture. They must store the prosthetic in water or a moist, airtight container when not wearing it. After eating, remove the prosthetic from the mouth and brush it or rinse the retainers, which are the clasps, the rests, and the complete partial. So everything should be brushed and rinsed. If they can't brush it, at least rinse it with water and rinse their mouth. But they should be brushing all of the remaining teeth in their mouth and the appliance every time they brush. And they should be also flossing the natural abutment teeth that are left to keep them free from food and debris when they are brushing. They should never try to adjust the partial denture on their own. They should always be brought to the dental office to be adjusted if it needs loosened or tightened. Thank you.